learn to be comfortable in becoming the first ones in whatever field. I think it's really intimidating to become the first one, but it's necessary. That's where we are in this point in history. There's a lot of people who are around my age that are now graduating from medical school who showed me that it was possible. So I know, at least for myself, I have a lot of people to follow their footsteps, but you may not have that if you don't have DACA, or if you're in a state that is very conservative, or if you're the first in your family. And so I think it's, a real big trap to feel hopeless because you don't have a previous example. But as long as you put one foot in front of the other and start digging a stack, asking questions, especially from those schools that are saying no right now, just asking why do they have that policy? Is there some prerequisite that they think is needed? Is there a background check that they think needs a social security number? And then you can start having those conversations. So I'm just going to give a broad overview about the different health careers that are available to undocumented students with and without DACA. And again, please feel free to leave your questions in the chat. I love this quote that I saw on Instagram from Dr. Erica Montes. Be strong enough to stand alone, smart enough to know when you need help, and brave enough to ask for it. And I think that's the one thing that all of us who are undocumented have in abundance. We're very brave. We have a lot of perseverance, and we have a lot of hunger. And, even when things are very dark and grim and you feel very alone, I think it's important to fall back on those skill sets that we've learned over the years and continue to pursue and push forward. Because with DACA, I mean, there had been advocates for decades who wanted some sort of immigration reform, but from one day to the next, DACA appeared. And there wasn't any heads up. It was just something that happened. And so we don't know what's going to happen going forward. We don't know what's going to happen with DACA. And all that you can do is to control that which is under your control, which is, possibly your education, making plans, continuing to work, continuing to save up money, whatever that step is for you, concentrate on that if it's under your control. And so, you have to choose your challenge. Whatever degree or career you want to pursue, it's going to be challenging as an undocumented student. That's the reality of it. It's not fair. It's very frustrating, and it can leave you feeling helpless. But you basically do have to make that choice for you. What is the challenge that you feel passionate enough about to continue to pursue in the face of all those haters, of policies, of mentors, of advisors, of friends who may not share that same passion as you? And so I kind of wanted to share a little bit of the background. Some of the attendees here, I think, are part of our mentorship program, our PEEP program. And this is a reflection of last year's cohort. There were about 70% who were pre-med students, 20% who were public health, 30% who were interested in pursuing some sort of PhD. That could have been in science, in social sciences, or humanities. So there's a lot of varieties. So wherever your path leads, you're not alone. There's a lot of people who, like you, are pursuing these careers too. And not only those popular ones, but also some that you may not have thought of before, like medical anthropology, respiratory therapists, engineering, optometry. I think it's just so wonderful because we need undocumented people in all of these fields. We bring such a richness, a new point of view, that they're lucky to have us in their programs. And that's the kind of attitude that we need to come in when we apply. It's not just us asking for a chance, fighting imposter syndrome, but really a lot of us have very unique experiences. Even amongst each other, we're very unique, that any program would be lucky to have. And so with this introduction, again, this is just a brief overview. I'm going to go a little bit more in depth into some of the step-by-steps in applying to medical school. And then, please ask me any follow-up questions, but hopefully we'll have time at the end. So here, the ones in red, I highlighted because they are the ones who somebody without DACA, who does not have an employment authorization, they can go to dental school, physical therapy school, or PA programs, and then they can go on and become their own business to work directly with patients. And that's because a residency program or additional training after dental school or physical therapy school or PA program is not required. That's only optional if they want to specialize further. And so that's where people who do not have DACA get stuck. Like, sure, they can get into medical school, all the Ivy Leagues and private schools, they accept you. They don't care about your immigration status. The problem, if you're pursuing medical school and you do not have DACA, is that you're going to be required to complete a residency program, additional training after the 4 years of medical school, in order to be able to work with patients. And right now, that's not possible without that, the work authorization or social security number. And so, there's a lot of people working on that right now to see if there's a way to change that. But as of right now, that's where somebody without DACA would get stuck. Of course, that doesn't necessarily mean that, they can't no longer use that MD degree. They can go ahead and become entrepreneurs. They can get involved in research, and having that MD degree would allow them to gain access to more funding. They would probably be earning at a pretty decent level, even if they're not practicing medicine with patients. And so that's also something to consider. But other options with DACA, for example, like biomedical science, clinical laboratory sciences, the MD program or the DO program. So for those of you who haven't heard a lot about the osteopathic doctor degree, it is a medical doctor. They pursue additional training to do more manipulation of the muscles and bones. And they have a slightly different philosophy about healing, but they are just as equivalent as an MD degree. Other options are nursing. Again, for all of these, they have their own nuance, and it's important, I think, if you have additional questions, to meet with us one-on-one to see what your situation is, because even with nursing here, you could pursue nursing without DACA, without that work authorization, and then become an independent contractor, which I'll speak a little bit about at the end. And so this is just, like a short list. There's so many careers. If you go on like any school's website and look further into the number of different health careers, you'll be astounded. And, another thing to consider is the number of years that it takes to earn those degrees. I think all of us who are, immigrants or children of immigrants feel that internal pressure to make our parents' sacrifice worth it, right? So I think our mind goes typically to becoming a lawyer or becoming a physician, but there are so many other options. And right now, schooling and our access to financial aid is very limited. So maybe a 4-year degree is not an option, but maybe a 2-year degree is. And there are programs where you can go part-time and you can work part-time. So you have to explore different avenues, ask questions of people who have made it to get those degrees, and see what fits best for you. Don't feel that internal pressure to pursue one thing without exploring other avenues too. And then in terms of timelines, these are general. So whatever you're looking into, whatever professional program or graduate school program, start thinking about what you should be doing. And it's never too late. Like, for example, I was kind of just taking classes, the same classes as my classmates. I didn't have a plan. I didn't know when I was going to apply. And so I ended up taking multiple gap years. I would say more than 5. And I think right now it's pretty normal for people to take maybe 1 or 2 gap years. So that's after you graduate, you take a year or 2 to prepare your final application. So that's taking any exams, doing any volunteering before you submit your application. But if you're in the earlier stages, start thinking about what you should be doing, really strategize. And there is always something that you can be doing in each of these years. But again, it's never too late. You can always do something to fix your GPA like me, or to become more competitive. And so some of the entrance exams that you'll be required to take, depending on what you're pursuing, could be the DAT for dentistry, GRE, MCAT, and all of these I'll speak briefly about, and I'll be sharing the slides later so you can take them and click on the links. I have a lot of links that are really good to just get general knowledge, because I feel like the information is spread throughout. There are so many resources. It's easy to get overwhelmed. But once you're ready to take your exam, register early. See if your school has any sort of prep course. I feel like a lot of the hesitation that I had for getting, enrolling in those prep courses was just the price. For the MCAT, I think Kaplan was $2,000, and there's other programs that are like $3,000 or $1,000, and it just seemed overwhelming. But it was a great investment. I ended up needing to retake my MCAT 3 times. The first one I thought, I've kind of know my foundations. I did very well in biology and chemistry, so I'm sure that it'll be fine. And I did a lot of content review, but not enough practice. And then the second time I thought, okay, well, now I know that I need to do more practice. But it was really that, test taking strategy, along with multiple questions and exams that you just practice and practice, that did it for me. So, I would say try to see if you can fundraise, see if your school has any discounts or prep courses that you can do in the summer that are a discounted price, because it's well worth it. And then don't take your exam until you're ready. I think there's a lot of people online who say, just take the first time so you can kind of see what it's like and you can get the nerves out of the way. But you really only want to be taking your exam once. Even schools, they will look at the different grades, and you can always explain it, I didn't take a prep course, or I wasn't really understanding what I was getting myself into, and that's fine. But it's becoming so competitive for all programs that they're, you might come across that situation where they're comparing you and another student who have, very unique stories, who have similar GPAs, and then it might come down to that MCAT. So you don't want to put yourself in that situation, and you really only want to take the exam once. If you take it, you did your best, and you still need to retake it, it's not the end of the world. I think it's pretty normal for people to take exams at least twice, if not 3 times or more. You don't want to take it more than 3 times, because you want to be able to demonstrate that you can learn from your mistakes and grow from them. And if you take the MCAT 4 times, of course, there's always extenuating circumstances that can cause you to do that, but it will become harder to explain that. And so just keep that in mind. And at least for the MCAT, there is a fee waiver that is open to all, whether you have DACA or not. All they require is an address for you. And that's very recent. It just passed last year. So I wanted to share that with you. I definitely recommend applying to that MCAT fee waiver, because you don't just get a discount when you sign up for the MCAT. You get a lot of prep materials. You get a book that covers all of the materials that you'll need. You'll get question banks. And then I think there's 20 schools that you can apply to for free with that. And it's good for 2 years. So if you decide you're not ready to apply this year, you won't have to reapply for that MCAT fee waiver again. And it's called the Fee Assistance Programs. And then, once you're signed up, you have that pressure. Now you have that timeline. So you can create a study plan. I link one here. And again, I'll share the slides with you so you can create a plan that works for you. And I feel like so many people burn out, and like they kind of jokingly say, oh, I scheduled a time to cry because I'm so stressed out about this exam. But you don't want to get to that point, definitely, absolutely, study every single day, take one day off. But when you do study, it doesn't have to be 8 hours a day. Of course, there's certain people who do, study for like a month and then they're ready to take it. But yeah, typically people take like 3 or 4 months to study for the MCAT, and I'm not sure how it is for other exams. So, do a little bit of research or what that average is, and then maybe add one more month just in case to have that little bit of breathing room so that you're not falling apart. I think it's such a high pressure moment that it's really easy to break down and have mental health suffer. So just make sure that you're giving yourself that time to prepare, to check in with your friends, to enjoy your hobbies, to spend time with family so that you can keep yourself healthy and understand like what it means to be scoring where you are. From the get-go, whatever your exam is, take a practice exam, see where you're starting. I think it's really scary. And then when you see that score, it can be kind of traumatizing to see how low it is, but it gives you an idea of where to start. Maybe you're kind of strong in the social sciences, and so you don't need to focus on that as much as you do the physics portion or the reading comprehension portion. And so it's really important to be able to do that diagnostic exam in the beginning to see how you're going to prepare, how you're going to make that plan. And so at least right now, I'm not sure, where you're at or whether you're applying to medical school. So I'll kind of just be brief about this and the other programs, but there are certain requirements for medical school. Typically, it's general biology, chemistry, organic chemistry, physics, English. And then some schools are making it biochemistry a requirement. Calculus is not required. I think it's only Harvard, maybe Johns Hopkins, Amherst who require calculus, and maybe like one other school. So, just do your research, see if you even need calculus, because that's a big misconception, even among advisors, that you need calculus for medical school. I think what's becoming more common is statistics. It's not necessarily a requirement yet, but it's like highly recommended for various schools. And then in addition to the MCAT, there's also new exams. So previously there was a situational judgment exam that they were recommending, and now several schools are making a couple other exams requirements. So the Casper one, which is a new situational exam, they kind of give you scenarios, ethical scenarios, and they want you to type out a response very quickly. That kind of shows your empathy and compassion, but also your ethics for the situation. And the preview exam is a professionalism exam. They want to see how you would react to certain scenarios, and how they do it is they just have like a sentence and then you say, very likely, unlikely, or like a Likert scale, how you would react in that situation. And a lot of schools are realizing that these exams are actually disproportionately impacting underrepresented students negatively. And so right now, I think a lot of schools are still kind of taking these as pilot years to see whether they should officially incorporate those. There's some who have officially incorporated those into how they're evaluating students, but I think there's still that understanding that there's a disparity in underrepresented students, and it's not being fair to them. So I think what we'll see in the future, they'll do away with those. I personally did really bad in one of them. I still got into medical school, so take that with a grain of salt, but I think there's a lot of schools who are looking at the whole applicant, looking at the population holistically, and one bad score, it's not going to be the end of the world. And so I have some of the information that I gathered here from these links. And then this is a sample timeline. I think this is kind of like somebody who is really on their game. This was me this past year. I applied early because I have everything together since like 3 years ago. I just needed to retake my MCAT. And so I was able to apply early. And I think that makes a difference. There's a lot of schools who are rolling admissions. So they'll start looking at the applications and start offering interviews as the applications are coming in. And then they'll start offering seats as they're interviewing students. And so you want to be kind of like in that group in the beginning where they're maybe a little bit more lenient as opposed to those last interviews where they have to make really tough decisions between applicants. And this is really great information that I found on AMC. So in the application, even the year before you apply, I think it's really great if you go in and make an account so you can take a look at what they're requiring. So you'll have to put in your background information. That's where you'll put your citizenship, and you can put whether you have DACA or not, and their coursework, any awards. You don't have to put in your letters of evaluation right now, and that's not necessary until later on. But it's good to know that that's kind of like where you'll be putting them, and you can go through other, for example, Interfolio is another service where you can collect your letters even years ahead, and then you can send them from Interfolio to the MCAS application, but that's really getting in the weeds. And you'll also be able to select the medical schools that you want to send your application to, and like your essays and your test scores. So it's just good to, I think that's what helped me to be able to see like what information was needed. I was still feeling really overwhelmed when I was applying, and there was so much writing, but it felt manageable. And again, this is kind of the timeline. So somebody might take the MCAT, for example, September before the summer when they apply, or they might even take it the summer that they apply. So that's here in gray. And then once you have the MCAT score and your submitted application and you've submitted all your transcripts, they can compare your transcripts to what you put in your application, and then you'll get verified if everything looks okay. If there's some discrepancies, for example, I had one school who did like letter grades and another one who did number grades. And so for the number grades, I thought I had to change it to letter grades. And so I submitted that, and they marked it as I submitted something wrong, but they understood what I had done. So they didn't ask me to resubmit my application, thankfully. So you just want to type out your transcript exactly as it is. You don't want to do anything with it. That's what I learned. And then once that's done, your application is considered verified. And then they can start sending out that primary application to all the schools that you list. And this is kind of the time when you want to start submitting your letters of recommendation. So I would start asking for those letters of recommendation as soon as I'm done with a class. For example, if I was a sophomore and I had a fabulous teacher that I really connected with and that I was going to continue to update up until I would apply, I would just ask them for that letter as a sophomore and then have them save it or submit it to Interfolio. And then 2-3 years later, when I'm ready to apply, then I could just ask them to update the date and submit it for me. I didn't know that you could do that, so I waited until May, and then I just bugged my professors a lot. I sent them multiple emails like reminders, and thankfully they submitted it by August. So it only took a few months. Be prepared for that. And then once I submitted those letters of recommendation and the secondary application, which is what the medical schools will send you if they want your money or if they like you, they'll send you a secondary application with specific prompts for their school. You'll fill those out. And then once you have that with the letters and the preview or the Casper exam, then your application is going to be considered complete, and you can kind of stop thinking about it for a little bit until they start sending interviews. If by November or December you haven't heard back and you submit it early, it's not the end of the world. If you're hearing a lot of rejections and it's November, December, and you submit it early, then maybe start preparing for reapplying. So continue volunteering, continue working on grades, potentially retaking the MCAT. But don't lose hope. There's always a chance that you could get an interview from one school, and that's really all that you need. One school saying yes, And so a little bit more about the preview exam. It's a lengthy one. You'll sit in front of your computer. They'll have somebody monitoring you, and then they'll have all of these questions that will kind of test your resilience, your service, your ethics, your cultural competence, your teamwork, and they'll ask it in different ways. It's pretty simple and straightforward. There's a lot of YouTube videos that you can look at to kind of prepare for it, but a lot of it is kind of just like common sense. Like, what will you do, and make sure that your response is ethical. I think like we know what real life is like, so maybe sometimes it doesn't exactly align with the ethics that are expected, but that's why I suggest reading up online on like YouTube or different platforms to see what their recommendations are for preparing for this exam. And they also have a practice exam, so you can do that and try the best that you can to kind of match what their expectations are. And then the requirements for graduate school, and again, this could be bench research, translational research, whatever it is that you're interested in, humanities, psychology. If it's graduate program, then you'll have to take the GRE. And I don't know a lot of information about like the GRE itself, but it's very program specific, where you need to score. So there's like really competitive programs, and there's not so competitive programs. And so just kind of look at what the average is for the different schools and the different programs, and what the requirements are for the different programs. Because somebody who's going, for example, for gender studies versus somebody who's going for psychology, they will have different admissions requirements. One might require calculus, one might require statistics. So you just have to do a lot of digging, even though it's just like it all falls under graduate school. They're all very program specific. And for becoming a physician's assistant, again, this is one of those careers that you can pursue as an undocumented student without DACA. You'll have to take chemistry, physiology, anatomy, microbiology, biology, and perhaps other classes that are specific to those programs in your area. And then you'll also have to have a certain amount of hours with direct patient contact. And so that could be, working at a free clinic, getting involved with health fairs. And it can take a really long time to accrue those hours. And it can be very challenging to find those opportunities. Some of the programs require, like 500 hours. Others, like the one that we have here in Seattle, where I'm at, the MCLEX program, I'm sorry, I'm not even sure what it's called. Let's go past that. They require 4,000 hours. So these programs, these PA programs, are typically for those who were physicians in other countries and then immigrated here, and they were not able to transfer their degree, and so they're kind of having to start over. But I've certainly know at least one undocumented individual without DACA who completed the PA program, and he had those 4,000 hours and an incredible story. And of course, he got into the program. And then, depending on the program, they might require either the GRE or a new one, which is specifically for physician's assistant, which is the physician's assistant CAT. And so you'll just look into the links here, and you'll find additional information on those exams. The requirements for public health, having that undergraduate degree, it could be a bachelor's of science or a bachelor's of arts. For me, I had a bachelor's of science, and everything that I'd done before was microbiology, except for that part-time position that I had in the public health division, where I was a translator and interpreter for public health studies. And that was pretty much like my only experience. And it was really just interpreting. I wasn't even doing public health research. I was literally just, transcribing what I was hearing. for my boss to then do those research studies. And still I was able to say, like, I have this microbiology degree, I have that ability to translate medical jargon, really complex information, into a way that anybody could understand, not only in English, but in Spanish. And I'm very passionate about making healthcare access available to everybody. So as long as you're able to communicate whatever your passion is and share a personal story, that will get you into any program. So the way that I would convey that is, for example, in your statement of purpose, you can start off with your personal story. It could be about you or a family member or your community. And next, you would tie it to the bigger picture. That could be your community, something that you've been working on, the skill set that you've gained. And then lastly, what you'll be bringing to the program and what you're excited to do within that public health realm or graduate program. And then again, look into the different schools. They could have different requirements. I'd already taken the MCAT once and it was okay. It was okay for public health, but not okay for medical school. And so they took that. But I was thinking, I'm gonna have to take the GRE in addition to the MCAT, and I couldn't. But thankfully, the schools and the programs that I applied to, they were willing and flexible to take the MCAT. A lot of programs during the pandemic actually did away with their testing. So like, you start digging, see if there are any schools around your area or that you're really interested in, and see if they even are requiring the MCAT or the LSAT or the GRE anymore. I think, the pandemic, kind of showed that all of these exams put a lot of stress on students that was just not necessary. And so they became a little bit more flexible. And I also wanted to share this because, I haven't started medical school, so I don't know what to expect, but for public health, I was shocked by the amount of reading. You can really only skim to come in prepared for class. You can only skim. So this was one of 8 classes, and I was required to read like 50 pages just for one day for one class. And that was something that I'd never been prepared for, that I hadn't heard anybody tell me. I mean, I knew people who were in graduate school who said, oh my God, it's so tough, there's so much work, but they didn't show me. So just wanted to share that with you. But it's totally doable. I think we become used to in undergrad to read all the details to be able to answer questions and to be able to synthesize something. But once you get into graduate school, you start to pick up those skills where, you're really only skimming for the who, what, when, where, why, and you highlight those, and you try your best to answer their learning objectives, and then you go into class and you speak up because you have such a unique experience. Whatever it is that you read, you're going to be picking up a new lens that nobody else will. And I think that's something that took me some time to learn, that I was so unique among my cohort. And, it is intimidating because, these people are really smart to be able to get into this school, but like, so did I, and it just never really clicked until like later on. But like, if you're in a program, you've earned your place there and you belong there, and you deserve to have your voice heard because your experiences are so unique that they will change how others view the world. In terms of post-baccalaureate programs, so I pursued a master's instead of a post-bac program because of the financial assistance. Like, when I went online, every program that I went into, they said, like, we don't have that. Wait, oh my gosh, how do you exit? I'm trying to show you technology. Okay, let me see. Every program that I looked into, they said, we don't really have any financial assistance for undocumented students, even students with DACA. And I don't have a US citizen who can co-sign for me. So I just thought, there's no way that I'm gonna be able to afford a post-bac program, even though that was kind of the recommendation that I received from when I applied to medical school the first time. And so I became really concerned because, I wanted to get into medical school. I wanted to follow the advice that they were giving me, but there was just no realistic way that I was going to be able to afford that program. And so I decided to pursue an MPH because it was something that I'd always dreamt about doing anyway, sometime in my career. Originally, my thought was I'm going to do it when I'm done with residency. Or I'm gonna do it, once that I'm attending. And it's really difficult to find that financial assistance, and you have to make that decision for yourself. Like, yeah, maybe that medical school is requiring me to do a post-bac program to improve my GPA, but it's just not realistic for my situation. So then instead of even like doing a post-bac or even a master's program, you sign up for the local community college and you take 1 or 2 classes as you can. And I think that's the beautiful thing about medical schools right now, is that they are understanding of that. They're going to look at your whole application, and there's always space for you to communicate that, that you just can't afford to take more than 1 or 2 classes, and that your only options were community college. And so right now I'm going to share with you, if I can, this site. It's where I was able to find the post-bac programs that accept those with DACA. There's going to be private universities that also accept students without DACA. But again, these post-bac programs, they're very challenging to find financial aid for. And here's a disclaimer I want to leave up just for a second. This is not an exhaustive list. Like they even say it, that it's a work in progress. It's been a work in progress for like 5 years. So kind of just look at this and then always check if you have like a specific school that you're looking into. I would suggest, calling them directly as opposed to relying on this. But here you can see that you can make selections, whether you're looking for undergraduate post-bacs or graduate post-bacs, or in those that accept DACA applicants. So that's pretty amazing that there's a database that kind of it's trying to do this, but it's not going to be perfect. And then so for Arizona State University, we can view some details here, and they'll have like whether they're degree granting or not. For me, it was important that I come out of a post-bac or a master's with a degree. For others, that might not be decision that they care about. So, see what's right for you. For me, it was just like, if DACA ends and I have to go back to Mexico, I want to have my master's and be able to do something with that. So it was very important to me to seek that degree. And then here you can also see whether they offer financial aid or not. And here they're not differentiating between somebody who's a US citizen or not. So this is most likely just for US citizens. But call them, ask them, you never know, especially for those Ivy League and private institutions, they have a lot of money. So even when they initially say, we don't have any money, they have money, persist. And then here again, it reiterates that they accept DACA. So here, they put a not available, or maybe not applicable, I don't know. So we don't know. We have to contact the school. And then these are a couple of contact. Now you can call them or email them. I would say email them, and I'll give you all a template to email them to see if they accept DACA students or undocumented students. It can be really nerve-wracking, and a lot of times you'll have to do the education. So I think it's really important to just ask those in an email format, to keep that chain, to see if there's anybody else that you can share that information with, if you can go up the chain of command, and really get at the root of why they're denying students or why they're not providing financial aid. Let's see. And then for nursing programs, nursing programs, they have so many different levels. If we go back to the to the one of the initial slides, you'll see that there's like 2-year nursing programs, there's 4-year, there's like accelerated nursing degrees, there's like bachelor's and doctorates of nursing. So there's really a lot of options for nursing programs. And for each of those, you can do it with or without DACA. Because if you're done with your schooling, you might not be able to go the traditional route as with any other nurse to become an employee with work authorization if you don't have DACA, but you can become your own independent contractor. You can work directly with families, you can work directly with celebrities, you can work directly with hospitals like other nurses, but maybe you do it as a travel nurse or independent contractor. And so there's just there's a lot of work and you'll need to do a lot of hustling, but it's possible. And these are some of the standardized tests that might be required. So again, you'll have to look at the different options for you and see what is the right choice for you. For dentistry, again, with or without DACA, you can become a dentist and you can practice dentistry. If you want to go on and have like more specialized training, you would need to go through a residency program and you would need a work authorization for that. But as a dentist, you can be done with the program and practice dentistry. And similar to medical school, you'll have those biology, general chemistry, organic chemistry, physics with lab requirements, and then you have to take the DAT or the dental admissions test. And for physical therapy, here's some additional information. We need PTs, we need undocumented folks in every field of healthcare. So I really encourage all of you to pursue all of these links. For pharmacy on this slide, the only thing I like to really highlight is when somebody says that they're going to pharmacy program, it can mean two things. So it could be, a PharmD program where they go on to become a pharmacist, where they, dispense medication at hospitals or stores, or it could be a PhD program where they're doing research on like medication and drugs. And so you have to be really careful about like which one you're looking into, because for example, if you want to go on to become a pharmacist and you don't have DACA, you're going to have to do a little bit more digging about like whether you will be able to practice or not. Typically, as a pharmacist, you would be hired like anybody else, right? Like go through E-Verify, you have to have that work authorization, but maybe you can sign up as an independent contractor and it might take a little bit more hustling, but it's possible. And then for the PhD program, well, that's more likely to get funded. Like you wouldn't even have to worry about funding your graduate program. I think that's the beautiful thing about PhD programs is that they are typically funded by the lab, or you're able to apply for grants that then cover your tuition. And they don't really worry about your immigration status and whether you're eligible for FAFSA, right? And so that's just something to consider, but I don't want you to get all excited about PhD programs covering your tuition if it's not something that you're passionate about. I don't want you to like pursue this other degree if it's not something that you're like ready to pour your heart into, because all of these programs are very hard. They're careers. They require a lot of sacrifice, and you can't use any of them as like a stopgap or like a career that you'll do now until your immigration status changes and you can pursue your true passion. I'm sure that there's people who can like push through, but all of these programs require so much of you that you do have to explore them. You have to shadow those professionals. You have to ask a lot of questions, do informal interviews, have coffee with all of these students, and see if it's the right path for you. Because like once you're in it, like of course you can always change your mind, but it requires so much of you that I just wouldn't want you to take the wrong path longer than you needed to. And then to go back on, okay, so what if I pursue one of these careers and I don't have DACA, or, DACA gets taken away? What can I do? So there are different states who have policies in place that allow undocumented individuals to get licenses. So professional licenses, business license, and I'll share the link for this list of states. But if you do not see your state listed here, it doesn't mean that they are blocking undocumented students from getting these licenses. It just means that there is no law that says that. So for me, for example, here in Washington State, there's no explicit law that quite says that, but people are able to go to medical school here and become doctors and become lawyers. For other states that are like really conservative, they sometimes make that decision on purpose to not pursue any sort of policy, because the moment that they start, advocating for additional undocumented people's rights, there's like a whole wave of people who will work against that. And so they don't want to draw the wrong attention. And so there's various reasons why some states have these policies and why some states don't. And you can see if maybe you can change that policy in your state if you want to. But just that's some of the feedback that we've gotten from places like Indiana, for example, that like they have some people who are really believe in undocumented students' right to education, but they know that if they make any sort of noise within the school that they support undocumented students, that there will be a whole community coming after them. And so they choose not to make that vocal. And so here I just kind of highlighted some California laws, Florida, Indiana, New Jersey, New York, and they all have like slightly different policies. Some are just for DACA recipients, some are for like all undocumented individuals. And again, I'll share that link so you have it with you. And let's see, so for the big pushback sometimes that we get from schools is that individuals will not be able to do their clinical rotations because they don't have a social security number. They won't be able to do a background check. But that's just not true. There's background check companies that all they require is like your name, your date of birth, and your address, and that's enough. And so if a university is working with an institution or a hospital or a clinic, and that clinic or that hospital has everybody do the HR paperwork and they require that background check from this specific company, and then that specific background check company requires a social security number, well, that could just be the thing to change. That instead of working with that background check company, you look into another background check company where all they require is your name, date of birth, and your address, and so again, that takes a lot of conversations, but something that we highly recommend is that all undocumented folks who don't have DACA look into getting an I-10. An I-10 is required for if you're going to be getting money, you're supposed to be paying US taxes, right? And so having the I-10 number allows you to be able to pay those taxes. And I'll again link all of this, like I know that we're right at time, I'm sorry. And so I'll just share all of this so you can have it with you. And for the citizenship questions that you get in different programs, it's really important to select the right one for you, because this is how they're going to start categorizing you from that moment on. If you, for example, don't see the correct choice for you, it's better to call the organization like SOFAS for the Schools of Public Health or MCAS for Medical College Application Service to verify what the right one is for you. Because your ability to access institutional aid kind of depends on what you fill out in your application. Like you can always have conversations and get it changed later on, but it's better to just kind of get that at the beginning. And please access all of our resources we have online. We have resources for medicine, pharmacy, dentistry, nursing, post-bac. And so when you're having those conversations with different programs, you can look at these resources and have that language ready to go. Because a lot of people might not know what it means to have DACA, but they will know what it means to have social security number, but no access to financial aid. So it's also a matter of speaking their language. And these are a list of the different resources that we have available on our website. So guides on post-bacs and dentistry programs and residency programs, and Q&A for nursing students in California. So with that, I kind of just want to open it up for questions, and then I'll leave my email here. I know that we're a little bit over, but if you want to stick around for these questions, let's see. So nursing requires clinical compliance, which doesn't allow undocumented to do the clinical segment of the 2-year program. So I'm not exactly sure what clinical compliance means. Would that be like the clinical rotations, Leslie? And I can stop the recording.